Anything can happen in a super busy hospital, like now. A man suddenly falls to the floor, with the moment captured on CCTV cameras. In the crush of helpers, Senior Emergency Dr. Martin Dutch takes control.
You're one of the anaesthetic cons, eh?
Yeah.
Yes, Martin, one of the emergency physicians.
1 minute, Dr. Martin is buying an orange juice. The next, he's trying to save a life.
I haven't even left the cafeteria when I look down on the ground and there is this gentleman who's collapsed. And it very much looks like his heart has stopped and the nurse is appropriately giving him CPR.
They have seconds to get the man's heart going, or he will die. Dr. Martin gives the man adrenaline to try and kickstart his heart.
We begin to see signs that this gentleman is coming back to life.
Senior Emergency Dr. Jonathan Papson heads next door to the ED to set up a resus bay.
I've lost track of exactly how many helpers. Myself, multiple anaesthetists, doctors from ICU, excellent nursing staff from the wards, all coming together to try to save this man's life.
All right, everyone's happy? Yeah. 1, 2, 3, yep.
What he doesn't need to be is in the middle of a cafeteria floor. We need to get him to a place where we can take better care of him.
All right.
He's got a radial pulse.
Yeah. Good.
This gentleman, even though we've restarted his heart, I don't know who he is, I don't know what medical problems he has, and I don't know why his heart stopped in the first place.
An adrenaline infusion, I imagine.
We're lucky it happened in the hospital, actually in our Zuki Cafe, which is right next to emergency. Otherwise, he'd be dead.
This gentleman's hypoglycemic at 2.8 BSL.
Back in resus bay 6, the team is desperately trying to save a man's life.
When you have a cardiac arrest, you're just about dead. And then you just have a couple of minutes, and after that, you're fully dead.
So he's been brought back from the brink. Thanks everyone for coming.
And all those lovely people who are extremely helpful needs to leave.
Yeah.
The problem is actually there's not enough room to move in this little room to actually assess him.
Let's just have the story.
Dr. Jonathan and Dr. Martin need to learn more about this man who was alone in the cafe.
2 questions. Who is this man? And why is he in hospital? And then 3rd question, why did he have that cardiac arrest?
Is it Martin? So we should sedate him and paralyse him and keep him asleep, yeah? Yeah.
I would go propofol and rocuronium.
He looks like a man who's got significant illness apart from the fact that his heart's just stopped today.
Which makes the risk even greater. The man could re-arrest in front of them at any moment.
We need to get a blood gas and a blood pressure.
The more times your heart stops, the more unlikely it is that we're going to be able to get you back.
Let's fix the airway. Circulation's all right.
Yeah.
Over in resus bay 6, Dr. Jonathan and Dr. Martin still don't have the information they need to treat a man who's clinging to life after a cardiac arrest.
And he's still at significant risk of his heart re-stopping again.
Can you listen to his chest? Tell me what his chest sounds like.
There are many different causes of why somebody's heart stops suddenly. Understanding a little bit about this gentleman and what his previous medical history is will direct me on what is the more likely cause for why his heart stopped.
You know, someone knows this guy from today.
He's in the cafe, he's in the hospital. Is he a patient of the hospital?
And he was hypoglycemic too, wasn't he? So what's all that about?
So we're looking for clues.
So, and he's got a fistula. Looks like it's been accessed. So that's a new access to fistula. Maybe he's just had dialysis.
All I know is a renal patient.
We realise he's a renal patient because he's got a fistula in his arm. So that's a good clue.
It's more than a clue. It's the breakthrough the team has been looking for.
Let me do the ultrasound.
Using hospital records, they discover the man in front of them is 46-year-old Andrew, a regular dialysis patient.
We like detectives. Sherlock Holmes, the guy who wrote Sherlock Holmes, he was a doctor, wasn't he?
They didn't pull off a gas or anything. No, but they got a sugar. Yeah.
I'm listing the likely culprits for his arrest. And every time I get a bit more information, that little list might change in my mind. I might put another one up to the top. Okay, actually, maybe that's the main thing now. I'm hearing some new bit of information. Maybe I need to slot that diagnosis to the top.
Dr. Martin begins looking for possible causes, starting with a chocolate the man was eating and a possible choking fit.
I'm expecting to see just a normal airway, however, maybe with some foreign body present.
Got some suction for him?
Yeah, it's my left.
Yep. It doesn't look like there's stuff in there.
No.
With choking ruled out, Dr. Martin continues to build a picture of other likely causes.
Now we know that Andrew has in fact got diabetes, and he's also a dialysis patient. Kidney dialysis patients are more likely to have narrowing of the blood vessels to their heart, but they're also more likely to develop problems in removing salts from their body, such as potassium. And when these salts build up, they can cause the heart to stop.
So the next thing will be, once we're in, we need to ultrasound what's going on with the heart.
Yeah.
What's going on with the lungs.
If you want me to stop ventilating at any stage, let me know.
That's the heart in the middle, and the outline of the heart's pretty much as we would expect. There's probably a little bit of fluid in his lungs, which you can see in this situation, but that looks all right. Just doesn't help me, essentially. Just reassures me, doesn't help me.
The team has tracked down Andrew's elderly father, while Dr. Jonathan and Dr. Martin try to stop Andrew from having another deadly episode.
It's not like he's out of the woods by any means. I'm really worried that Andrew's going to have another cardiac arrest because I haven't found the cause.
So the problem is still there as far as I'm concerned.
Diabetic Andrew, who had a cardiac arrest in a cafe at the Royal Melbourne, is being scanned for clues to try and solve the mystery of why his heart stopped.
What's it going to be? I can't believe he was so hypoglycemic that he arrested.
No.
Every question I ask, I'm getting another series of questions. It's a can of worms that keeps opening up with this gentleman.
So far, they're no closer to pinpointing the cause.
His blood pressure's fine. He's not febrile, is he? No.
So we went to CT to make sure Andrew didn't have a complication of the arrest, like a stroke or a brain hemorrhage or something like that after falling. He's not bleeding internally. So what's the cause?
Andrew's mystery collapse is the talk of the ED.
Brain normal. Doesn't really help, does it?
That's one of the things I really enjoy about emergency, actually, is bouncing ideas off people and getting their opinion.
And he maintained good sats and all of that sort of stuff. So, yeah, I...
How puzzling.
But he was only in ICU, like, a handful of days ago.
Right.
He's not a well man.
No.
Andrew is now being admitted for more tests.
And one of the best tests is time and just watching and see what happens. But look, my main goal here is to make sure that one of those big bad causes of cardiac arrest isn't there, and it's not going to happen again. He's not going to re-arrest.
The 46-year-old is being closely monitored.
Well, do you want to get an EDA and I'll just check whether it's ordered? Are you getting it?
Doctors also discovered Andrew lives with his parents and has been a type 1 diabetic since the age of 5.
Sometimes the pieces of the puzzles don't fit together in emergency, but eventually they'll get sorted out. We have a limited time with the patients in general. We'll label big picture issues, but there's a lot of stuff that will need to happen with someone like Andrew to actually work out what the cause is and what the overall therapy is.
For now, Andrew is safe. The most important thing is the hospital saved a life today.
Andrew happened to be in a middle of a hospital where bystanders saw that there was a problem, started CPR and asked for help. And that's what saved Andrew today. I was just the cherry on top at the end of that line of people to come and give Andrew a hand.
9 days ago, 46-year-old diabetic Andrew collapsed in the hospital cafe from a cardiac arrest.
I haven't even left the cafeteria when I look down on the ground and there is this gentleman who's collapsed and the nurse is appropriately giving him CPR.
He was brought back to life by senior emergency Dr. Martin and the team.
So this gentleman's an outpatient who's had an unconscious collapse. He's hypoglycemic at 2.8 BSL.
Andrew has made an incredible recovery from his near-death experience.
Other than the sore chest where they gave me CPR, I feel fine.
While doctors weren't able to pinpoint the exact cause of Andrew's cardiac arrest, he's thankful to the team who saved him.
If it wasn't for them, I wouldn't be here.
Andrew is looking forward to going home where he lives with his parents.
If it wasn't for my parents, I don't know what I'd do.
Trauma over TV.
With another trauma on the way, emergency doctor Scott Taylor picks up the case.
I have a young female, whose name is Joanna. Apparently she's been found this afternoon in an unconscious state of GCS 3.
A young woman is being rushed into emergency after she collapsed at home.
How far off?
5 to 7 minutes.
Okay. If I hear somebody's got a GCS of 3 and a headache, we're thinking things like bleeding in the brain, seizures, brain tumours, strokes, brain infections, all nasty things and all things that are life-threatening.
Should be here in a minute.
33-year-old Joanna arrived from Chile just a month ago to chase her dream of studying English.
All right, anything change, guys? Joanna, can you open your eyes for us? Joanna. So we'll go onto the board on 3. 1, 2, 3. Joanna, hello. You're in the hospital. I'm Scott, one of the doctors. Do you have pain anywhere at the moment?
This is Joanna. Complained of a worsening headache over the course of today.
She's stiff. She's really stiff.
You mean meningitis or something?
Yeah. Well, I can't flex her head at all.
Yeah, you're right.
I'm seeing in front of me a patient who's got a really stiff neck that I can't bend. Meningitis is a possibility. Meningitis is an infection of the lining surrounding the brain and the spinal cord. People can get very sick very quickly from it. They can have all sorts of organ failures, so people can die.
When you're happy, can I sit her forward and have a look at her back? I don't see any rash or anything. Yeah, she's so stiff.
I'm not seeing any signs of a rash, so if it's not infection, the next most worrisome thing, it could be a bleed from an aneurysm or a weakening of one of the arteries.
So she was with her friend in the apartment. She asked her friend to get her a pillow. The friend came back with a pillow 2 minutes later and then was unable to rouse her at all. That's where we're at. Any questions?
Do you want to bring the housemaid in? What was your name?
Dariela.
Joanna's housemate, Dariela, managed to call the ambulance despite speaking little English.
Are you from Chile as well?
Yeah.
With all her family in Chile, Joanna doesn't have any loved ones by her side to comfort her.
Working diagnoses, subarachnoid hemorrhage.
Subarachnoid hemorrhage is a bleed on the brain. In most cases, it comes about from a rupture of an aneurysm. You can definitely get brain damage from this, or in most severe cases, die.
Yeah, Christ. We'll get her to CT ASAP. We're going to hold off on antibiotics for now. The priority is going to be to try and facilitate the CT first.
Dr. Scott's moving fast to get Chilean student Joanna to the CT scanner after she was found unconscious at home.
Working diagnoses, subarachnoid hemorrhage.
He's worried the 33-year-old has a severe bleed in her brain
CT pretty much ready for her.
that could be catastrophic.
All right, are we good to go? Yeah. Doesn't speak much English, but not really getting any history out of her. 1, 2, 3. So she's really stiff in the neck.
Dr. Scott's alarmed that Joanna's condition is deteriorating
Can we get Reg to have a look at the scan in real time?
and needs radiology registrar Dr. Sebastian Sereden's help
Evening, how are you?
to get an immediate diagnosis, as every second counts.
She's got really significant nuchal rigidity, and she just kind of kept clutching her head in the back of her neck. So I don't know if she's got subarachnoid or she's got encephalitis.
Oh, Jesus.
Dr. Scott's worst fears for Joanna are realised.
Oh, no. We're very clearly seeing that there's blood in and around her brain. So that would suggest that she's probably had an aneurysm that's ruptured. It's awful seeing that. That's a person who's lived a life, who has hopes and dreams, who has friends and family that care very much. We're really worried that things are not going to turn out well.
To me, this seems to only be the ventricle, not really anywhere else.
It was midbrain as well there, wasn't it?
To have any hope of saving Joanna's life, Dr. Sebastian must work out how widespread the bleeding is and exactly where it's coming from.
Maybe some assistance here, even though there isn't blood lower down here.
I'll get neurostats down.
Yeah, sounds good.
I'm just in CT at the moment. We've got a 33-year-old female who's got a head full of intraventricular blood.
We're seeing blood around the brain stem, where we know lots of important brain functions come from, like our breathing. Her conscious state could potentially drop. She might have seizures or stroke-like symptoms. So things kind of have to move fairly quickly from here.
Hey, it's Scott. Hey, she got a head full of blood.
Dr. Scott and the team are urgently scanning 33-year-old Joanna for a life-threatening bleed in her brain.
Injection, just very still there.
You see anything?
Yeah, left vert. It's got something that's looking sus there.
Dr. Sebastian thinks the blood is coming from a burst blood vessel in the back of her brain.
So I'm going to give ICU a call.
This is worse than what I'd expected. I certainly wasn't expecting to see blood that deep in the brain, where it can potentially cause a blockage that can be life-threatening.
Okay, sure.
What language? No, actually, Spanish.
Spanish, yeah. Do you speak Spanish?
I did a little bit before. Joanna, el médico. ¿Cómo está? Joanna?
The team check to see if Joanna can respond at all.
Joanna, squeeze my hand. Squeeze my hand. Joanna, what's your name? Can you tell me your name? Have we been able to get much out of her at all?
I've got nothing other than incomprehensible sound.
We're still concerned about Joanna's conscious state, that there is some injury to her brain as a result of what's happened.
Oh, hey, how's it going?
Joanna's condition is critical. Dr. Scott prepares her for emergency surgery.
We've just got a referral down in Resus 4. She may be for neurosurgical intervention tonight.
Patients with aneurysms that rupture have a wide range of outcomes. Some patients have a full recovery. Some of them, unfortunately, do die. We've done everything that we can in the emergency department. It's up to the other staff in the hospital now to take good care of her. They'll give her every chance.
Joanna, can you open your eyes for us?
33-year-old Chilean student Joanna was rushed into the ED after she was found unconscious.
She's really stiff.
Dr. Scott's worst fears were realised
Oh, no.
when they discovered a burst aneurysm in her brain.
Got a head full of blood.
Neurosurgeons tried to save her life with an emergency operation.
We're really worried that things are not going to turn out well.
10 days after surgery, Joanna's well on the road to recovery.
Te quiero, te amo.
With her mum, Nalida, making the long journey from Chile to be with her.
If your mom is with you, you're in peace.
Two months later, Joanna's enjoying her last days in Melbourne before returning home to her family in Chile.
I feel so lucky. And now I feel I have a new opportunity to live. I want to appreciate that. I want to say to the doctors and nurse, thank you a lot, because you saved my life. Yeah, I'm so grateful.
Good morning, Royal Melbourne. We come up to you this morning with a approximately 47-year-old male. He presents with sudden onset of dyspnea at about midnight against the setting of a couple of weeks of general malaise.
What's the ETA?
15 to 20 minutes or so.
Cheers, we'll see you then.
So, 47-year-old, can't breathe. Sounds like 2 weeks of respiratory illness, and now he's really out of breath and really unwell. And the ambulance not sure what it is. possibly pneumonia or a viral infection. Doesn't sound well though, so I need to find someone who can look after him.
Dr. Jonathan hands the case to trusted colleague, emergency Dr. Michael Dunn, who's been on the front line in ED for the past 8 years.
Jonathan's told me a gentleman in his 40s coming in is really struggling to breathe. His breath per minute is 50, but normal is about 12 to 15. That rate is not sustainable, so this guy could go downhill very quickly.
47-year-old Suryadi from Indonesia was staying at his son's house when he started struggling to breathe.
Are those sats what you've been getting the whole time?
They've been a little bit variable.
Hi, I'm Michael. I'll be looking after you today, all right? Ready, 2, 3, go. Okay, sit him up. Get some monitoring on, Mark. Be great.
With Suryadi in such distress, Dr. Michael immediately starts his examination.
It's very wheezy.
I can see from how hard he's working to breathe that he's really, really struggling. He only has probably about 10-15 minutes before he starts to get weak and tired. So we need to fix the underlying problem as fast as we possibly can.
Can I get you to get pulse oximetry on for him? Let's actually quickly just get access and a gas and see where we're at. Okay. Can I get a truncated handover? Quick one?
Yep, quick one. So 47-year-old gentleman lives at home, been in the country for 3 months or thereabouts, doesn't speak English, from Indonesia.
Yeah.
He's been generally unwell with a bit of a cough, dry cough for the last 2 or 3 weeks.
Yeah.
Last night about midnight, felt sudden onset of dyspnea.
Yeah.
And that's progressed throughout the night. His daughter found him this morning looking like he is now, called the ambulance.
All right, thank you. Okay, let's treat it as a non-infective exacerbation of COPD. We'll get access, give 8 milligrams of Dex.
This potentially could be COPD, which is similar to asthma, makes it really hard to breathe. So I'm going to give steroids, we'll put on a special mask until we can get some further tests back to confirm what we think is going on.
Hi, can I get portable X-ray and resus too? I'll put a request through in a second. Yeah, please, yeah, thanks.
Hey, I'm so sorry. Very tight, but still help me breathe, okay?
Suryadi needs urgent help to breathe. The team hook him up to an oxygen supply as blood tests and X-rays are fast-tracked.
X-rays, ready. He's got pneumonia there, isn't he? On the right side.
When I see the X-ray, the first thing I'm thinking is this looks like pneumonia. And it might be driving all this, or it could just be another symptom of a more sinister process.
Is he febrile with us?
37.2.
37.2. So we'll bring down the pressure support a bit. That's a bit too high, probably.
Dr. Michael is waiting for the blood results to help him understand what's going on.
Michael, I've got a pH of 6.9, hemoglobin of 76, I think. Temp 21.
Jesus. 21.
One of the blood tests we get back is a lactate, which is really a marker of how sick you are. Normally it's 1, maybe 2, and Suryadi's level's 21. He is minutes to hours away from death. We really need to figure out what's going on. There's a good chance Suryadi's going to die today.
Pain? Sore?
Dr. Michael is ultrasounding 47-year-old Suryadi, desperately trying to figure out what's causing him to be so unwell.
We still don't have a clear reason as to what's driving all this. Potentially could be a very severe infection and it's affecting his lungs, his heart, but the bits of the jigsaw aren't really fitting together.
Dr. Michael tries to rule out a potentially life-threatening condition.
I'm going to try and get a view of his tummy just to make sure he's not having a AAA. I don't think he is. It doesn't make sense as to why he'd be in respiratory distress if that was the case.
The ultrasound I'm doing can tell us if there's a burst blood vessel in his tummy. It doesn't explain all symptoms, but it's one of the things I want to look at that cause you to be that unwell that quickly.
No, I guess his aorta there is very small. No, his aorta is tiny.
Dr. Michael is still no closer to knowing why Suryadi is so sick.
So he's had Dex, he's had salbutamol, ipratropium. I need to get a story as to what's going on.
We're slowly working through the potential life-threatening illnesses that can cause him to be as sick as he is. But I need more information in the next hour or he's going to deteriorate even further. So we don't have the luxury of time. We need to figure out what's happening and we need to know now.
Do you have pain? Pain, no?
Dr. Michael urgently needs some answers. he asks family friend Irvin to get Suriati's son on the phone.
Hello. Hi, how are you? I'm Michael, one of the doctors here in Royal Melbourne. I'm with your dad.
Okay.
He's quite sick at the moment. I was just wondering, has he been unwell in the last few days?
Yeah, he's been unwell since last week, but it's just like coughing and fever.
And before that, he was well. Is that right? So 2
Before
weeks.
that, he was well.
Are you coming into hospital?
Yes, I'm picking up my mum right now. I'm now get to hospital probably like in half an hour.
Okay, perfect. I'll see you when you get here, okay?
I'll see you.
Thank you.
Thank you.
Thanks. Bye.
We're no closer really at this point to figuring out what's going on. So it's really about keeping him from getting worse until we have answers. He is easily one of the sickest patients I've seen, and by far the sickest patient in the ED at this point in time.
Little injection, okay? Little injection.
Dr. Michael is trying to save 47-year-old Suriati, who's gravely ill and struggling to breathe.
I think we just assume it's respiratory sepsis.
Dr. Jonathan is helping search for answers.
What do you reckon's going on?
I think he's got really bad sepsis, and he's possibly gone into a high-output cardiac failure.
Yeah, okay.
That's my working diagnosis at the moment. His lactate's 21, though.
Having colleagues to bounce ideas off as to why someone's so sick is very valuable.
It's not myocarditis or something. It's not like
His
a...
heart's moving too good.
Yeah.
His echo looks fine.
What about primary lactic acidosis? And it's all just metabolic, like leukemia.
Yeah.
You're okay.
Looks terrible.
With Suriati deteriorating rapidly, more detailed blood results are phoned through.
Great, thank you for that. Appreciate it. Cheers. His white cell is 77, apparently.
No.
Yeah.
What's going on?
It's got me leukemia.
Yeah.
Normally, you'd have white cell count 4 to 8. If you're sick, it might be 12, 15, and his are 77. So that's really pointing towards leukemia or lymphoma or some sort of blood cancer. I don't know, will he survive the next 24 hours to get the treatment he needs to treat this?
I've requested units of blood. We need to get them down. There's some additional blood tests that need to be sent off before we do that. Yeah. The immediate plan is to give red blood cells.
As the team prepare to give blood, Suriati's wife, Novalita, and his son, Rafa, have made it to the hospital.
Hello. Hi, Michael. Nice to meet you. He's very, very sick. His white cells, which is the cells in the body that fight infection, are very, very high. Higher than we'd ever expect them to be. And we're doing some additional tests to figure out why that might be, and is there a problem with his blood that's causing him to be this unwell.
Normally, when someone's very sick, I like to be able to take my time with the family, but given how sick Suriati is, I don't have the luxury of time, and nor do the family. So I want to let them know he may have very limited time left.
We'll have more answers soon, but at the moment, he's very, very sick. Probably one of the sickest people in the hospital at the moment.
The team know that Suriati won't survive much longer without intervention.
I think he's going to end up being tubed.
He's going to tire out, isn't he?
He's going to tire, yeah.
They urgently need to put him to sleep and take over his breathing.
Give me a yell if you want help. Yeah.
The worry with intubating is that when you stop someone breathing, even for the minute to put the tube in, that's a very high risk time where their heart can give out. I don't know if when we put the tube in and put him to sleep that he'll ever wake up again.
Have you said goodbye to him, spoken to him? Okay. The hematologist will take you to a quieter room. Just rest assured he's been looked after very well, okay?
They urgently need to put in a breathing tube to keep him alive.
So I'm going to drop the bicarb in, then I'm going to drop the drugs in.
For such a risky procedure, Dr. Jonathan steps in to assist.
Then we're going to lay him flat, right? You're going to tube, and then we're going to just hyperventilate and try and match the breathing.
This is not an easy intubation. So many things can go wrong here. He may be building up blood in the lungs. That means we have less time to get the tube in before you get irreversible damage to your body.
The other thing is he is at high risk of just arresting after induction.
Yeah.
Can you draw me up some 1 milligrams of adrenaline?
Yeah.
Make no mistake, Suriati is at a high chance of having a cardiac arrest whilst we do this intubation. Despite all our good planning, it may still happen. So we have to be ready for it.
can't breathe? Yeah. It'll be all right. We're going to make you breathe very soon. All right. Looking good?
Yep.
Ready to go?
Yep.
Let's do it. We're just going to drift you off to sleep now. That's 100 of ketamine.
Yep.
That's 100 of rockuranium. Let's flatten. Let's go back. All right. Let's go, Thomas. 1, 2, 3. All right, let's put pillow under head.
Yeah.
Can you do it from there, Michael?
Jonathan's role is to give the drugs that put Suriati asleep, but also keep an eye on his blood pressure and heart rate and oxygen levels, where my role is to get the tube in and get it in as quickly as possible.
That 30 seconds post-rock.
Keep breathing, keep breathing, keep breathing.
45 seconds.
Someone's as sick as Suriati, you have no time. I have less than a minute to get that tube in, or things will go south.
Nice and fast, keep going. Boom, 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 boom. Ventilate, ventilate, ventilate.
And that's a minute post-rock.
Okay, go.
Let's go.
Suction.
No. How's that?
Yep. Bougie in.
All right, bougie through the hole. Beautiful. You're in the spot. It's all looking good, Michael.
Yeah.
Airway is good, so I'll call for a chest X-ray.
Yeah, please, yeah.
But it sounds like the tube's in the right spot. He's really critically unwell, this guy, but it's touch and go. He could still arrest any moment. We're doing everything we can to stop that, obviously.
With Suriati now on a breathing machine, but still dangerously unstable, Dr. Michael keeps a close eye as they prepare to move him to ICU.
When Suriati hits ICU, they will continue to monitor his blood pressure, his breathing, and as soon as possible, commence him on some form of chemotherapy to try and treat the cancer we think he has.
I'm happy to go if you guys are happy to sort of help us get to the lift.
Yeah. Even though we've done everything we possibly can in ED, I still feel a little bit disheartened because there's a high probability he's not going to survive this. Only time will tell, but hopefully he pulls through.
"47-year-old Suriati arrived in ED, struggling to breathe.
Pain? Sore?
Dr. Michael feared he would not be able to save him.
Lactate 21.
Jesus.
Blood tests revealed he could have leukemia and was only hours away from dying.
He is easily one of the sickest patients I've seen, and by far the sickest patient in the ED at this point in time.
It's now been 3 months since Suriati's shocking diagnosis, but his son Rafa can't forget that day.
It was so scary to me because the doctors told me your dad might not survive in the next couple of hours. It's very confronting to me and to my mom. Halo, Ma.
Ya,
Udah bisa jalan-jalan dong sekarang?
ya bisa. Aktivitas sedikit-sedikit tapi belum sepenuhnya.
Suriati is now back in Indonesia after spending 5 days in ICU before moving to a cancer centre for chemotherapy treatment.
After a few days, he made recovery and he's now on ongoing treatment to treat his cancer.
Suriati is now enjoying each day and getting stronger.
I try to call my mom every day to check on everything, how that's going. He can do more things himself, going back to the garden, doing his farming. I'm now very relieved that my dad is going to be well. It was very remarkable the way Royal Melbourne Hospital Emergency Department taking care of my dad. It's like a miracle.
Vic, why have you come in today?
Basically, the entire left side of my body is numb.
And how long's that been a problem for?
Around 9 days.
Okay. And you've been to hospital twice, but it's getting worse, is that right?
Yeah.
Yeah.
Vittorio's got numbness on one side of the body, and that is really abnormal. It's a really abnormal feeling, and he'd made the right decision in coming to see us today.
So the first day I noticed when I got out of bed that my foot was numb. And then I kind of just ignored it. I was like, yeah, whatever, it'll go away. And then the next day the numbness spread up to below my knee. And then I went to hospital to get it checked up. Yeah, they did some blood scans, they did some CT scans. and I got an x-ray on my back as well, and everything came back normal. And then today I woke up, and then that was when the numbness spread up to my face, and then that was when I thought, better come in again. So I'm back again.
Vittorio's 21. He's about 6 years older than my son, and I look at him alone and I kind of see, that young man ready to start his life, and I can't help but think of him in the same way that I think of my son, just wanting the best for him, wanting him to have nothing wrong with him, but knowing that there probably is something wrong with him.
I don't really do anything. I'm a bit boring. I'm a medical science student.
Vittorio mentions he's lost 6 kilos in the last 2 weeks.
And do you feel like you look different after losing weight, or not really?
No, not really.
No. Did your mum and dad notice?
I don't think so.
No. I've started to ask him a couple of screening questions to look for causes, including cancer, asking about weight loss and sweats at night. And so you felt hot at night, but not drenching sweats?
Yeah.
Yeah. But different to normal, you think?
Yeah.
Yeah. And to my surprise, he has had quite a significant amount of weight loss, which does make me more worried about possible problems such as lymphoma.
Vittorio stays in close contact with his parents, who aren't able to be with him today.
And he's regularly updating them. They know something's wrong, and they're really just trying to seek those answers of what's going on with their son.
I'm a bit worried. Yeah. Just want to get some answers and know what it is.
How are you with needles? We're about to find out.
21-year-old Vittorio is undergoing a barrage of tests, starting with blood analysis for numbness down the entire left side of his body.
He's presented with 9 days of progressive numbness on his left-hand side.
Dr. Emma is discussing his case with a neurologist.
He lives with his mum and dad, no recreational drugs. He's a medical science student.
This is the second time Vittorio has gone to hospital. The first time, all the tests were clear. Dr. Emma is repeating the tests to make sure nothing has been missed.
So interestingly, he's lost 6 kilos in the last 2 weeks, just thinking about other causes, including something like a lymphoma or something like that. But he's not eaten differently. He doesn't really understand why. I think he will need an admission to sort this out. Would you agree? Will I book a neurology bed? Yeah. Yeah, sure, perfect. I appreciate it. Yep, no problem. Good on you. Thanks for seeing him. Bye.
For the medical science student, it's all a bit of a shock. The numbness has come out of the blue.
I haven't had any problems as bad as this. This is a bit bad.
Vittorio has a look on his face that says calm, but there's also, just below the surface, there's that, worry.
Along with Vittorio seeing a neurologist, Dr. Emma is keen to see what a CT scan tells her.
What I'm looking for is, or hoping not to see, is, a brain cancer, a brain tumour. Also, there could be other causes, including strokes, less likely for a young man, but certainly not unheard of. The CT scan shows that there's no mass in the brain, which is good, so no cancer in the brain, but he needs more testing.
The medical science student and Dr. Emma are preparing themselves for another possible cause for his numbness. And it could be life-changing.
And the next type of scan that he'll need is an MRI. That will look at the brain in much more detail and in particular address whether or not it could be multiple sclerosis as the cause of his numbness of his body. I think for any young person to be faced with a chronic medical condition, that's what Vittorio's facing now. It's pretty confronting.
Medical science student Vittorio came in with numbness down one side of his body.
Vittorio's 21, he's ready to start his life, and I see, that young man just wanting the best for him, wanting him to have nothing wrong with him, but knowing that there probably is something wrong with him.
Concerned, Dr. Emma scanned him, suspecting it could be cancer or multiple sclerosis.
The CT scan shows that there's no mass in the brain, which is good, so no cancer in the brain, but he needs more testing.
I'm a bit worried. Just want to get some answers and know what it is.
The results were inconclusive. And while the numbness has gone away, Vittorio is having ongoing tests. In the ambulance bay, paramedics are arriving with a 76-year-old man who has extremely itchy skin.
He looks really itchy.
I don't know anything about him yet.
Perfect.
We can learn together.
Emergency Dr. Michelle Thornhill and nurse Abby Fistrovic are not sure yet what to make of Ray's symptoms.
He is obviously distressed by this itch, and as I am talking to him, I'm noticing that he is very focused on the scratch, that he just can't stop.
Hello, sir. What's his name?
Raymond.
Hello.
Ray.
Nice to meet you, mate. I'm Abby. I'm one of the nurses. This is Michelle, the doctor.
Oh, dear. We gotta do something about this itching. It's driving you nuts. Oh, man. Okay. It could be a number of things, anything from an allergic reaction or some underlying illness, and that might be causing a rash. On 3. 1, 2, 3. Oh.
Ray's wife of 51 years, Chris, was so worried about him, she called an ambulance.
So today, Ray has woken up and been very confused and lethargic, can't answer open-ended questions, and can't really obey commands unless they're very, very short, easy commands.
Ray's heart is also beating fast and his temperature is up.
So it's just a marker of unwellness, but it's hard to tell initially what's going on and what the cause is. When was it you really started to go downhill? Was that yesterday?
Hard to say.
Dr. Michelle finds out Ray's recently had an operation.
He unfortunately had a skin cancer on his scalp, and he had plastic surgery recently to remove that cancer and the tissue around.
A skin graft was taken from Ray's leg to replace the skin on his head.
So it's mainly your itching, your sort of aches all over, and then you had this graft a few days ago. All right. I'm starting to put a picture together in my mind, and the first thing I'm really concerned about is infection.
Based on Ray's rapid heart rate and the temperature he's running, Dr. Michelle believes he has a sepsis infection.
When we say sepsis, we usually mean that there is an infection that has spread into the bloodstream.
Doing your temperature while you do that?
Is your head sore here where they put the graft on?
The graft on and the graft's moved.
Okay. I'm really concerned for Raymond. Sepsis can be life-threatening, so it's really important to work hard and fast to treat him with the strongest antibiotics that we can. $37.9, I heard you say. I was just going to ask you. Okay, so it's probably on its way down after he had some Panadol and some fentanyl.
Along with itchiness, Ray has a rapid heart rate and a high temperature. Dr. Michelle believes he has an infection which has entered his bloodstream and can be life-threatening.
But this itching for you is sort of normal?
Yeah.
Yes. Okay, so it's not new that you're this itchy, correct?
Correct.
Okay.
But Ray's itchiness still has Dr. Michelle baffled.
I was trying to figure out what was causing this itching, and then we get more medical history, which gives us a vital clue.
Dr. Michelle and Abby go online to figure out what Ray has.
Here we go. Sézary syndrome. We hear that Ray has Sézary syndrome, which I've never heard of before. We were both quite baffled. Cuteness T-cell lymphoma. Certain white blood cells called T-cell become cancerous, affecting the skin. Never heard of it.
No. Okay.
Interesting. Okay.
So Sézary syndrome is a rare form of cancer. It affects a certain type of the white cells in the blood and manifests as a primarily skin condition where people can have rash all over the body, presents as being very itchy a lot of the times, and they can develop multiple forms of cancer of the skin as well. Just gonna have a look over here. Sézary syndrome does explain the itchiness and redness of his skin. And also part of the treatment is long-term steroids, which puts Ray at increased risk of infections because it can weaken the immune system. So it does help to explain why he has this infection happening now.
Ray's been given antibiotics while the recent skin graft to remove a melanoma on his head is washed and bandaged by Nurse Gunnar.
Well, how long since you retired?
20 years now.
20 years?
Yeah.
All right.
Just where the infection is coming from remains a mystery, but the graft has not been ruled out.
He needs x-rays and scans to see where the possible infection might be.
In the emergency department, Ray is waiting for next steps after having the wound on his head dressed and bandaged.
How are you feeling now?
Oh, apart from death, I'll leave it as is.
After being made comfortable and with his wound dressed, there was only one person he wanted to talk to.
I'm hoping to eventually see Chris, and I've been married with her now for 51 years, and boy, do I love that girl. That's me 3 little chihuahuas barking.
Oh dear, how are you?
No, all right.
I spoke to the doctors, I spoke to the specialists.
You know more about it than me then, if that's the case. Give me a report.
Well, she said that she's not too sure where the infection's coming from. You've got to be so careful, Ray, with the infections. You've got a lot of good nurses and doctors around you there, Ray.
No, that's
darling,
good.
You're sounding so much better. You made my night now.
No, that's good. Toots.
It is amazing that, you know, some people just have it really hard. He's had a lot to deal with this condition, and it's amazing that he can still put a brave face on and still crack a smile and even make a joke.
Ray is now being transferred to a cancer centre to treat the blood infection and monitor his ongoing condition.
After Ray got admitted to the cancer centre, he's had a really long course of multiple admissions, multiple further infections. He has in fact passed away from his disease.